visible to the optical eyes except under microscopy. So when a man releases this semen in the side of the vagina during sex, millions of the healthier sperm cells immediately goes through to the cervix within seconds into the uterus, and others may take some time, that is minutes or hours, but the healthiest ones take few seconds and they are already inside the uterus. Now here's the catch. For the man to be fertile, at least 50% of those millions of sperms need to be active, and you only require just one healthier normal sperm cell to fertilize one egg to get a woman pregnant. So imagine millions of these healthy sperms getting into your uterus, but after battling with each other, it is only one that successfully gets into the fallopian tube to fertilize an egg. So when you see some of the semen leaking out of your vagina, which contains millions of sperm cells, you don't have to worry, because the healthier sperms have already made their way to the uterus and the fallopian tube, ready to fertilize an egg for pregnancy to occur. Those sperms inside the semen leaking out of a vagina after sexual intercourse are likely and mostly the unhealthy sperms with low mobility and then abnormal shape. So our first question, which was, does sperm leakage affect pregnancy, has been answered. It does not negatively affect your chances of getting pregnant. You don't have to worry when you experience this leakage. And yes, you can get pregnant with or without sperm leakage. It does not affect your fertility. If you have a fertility issue, the leakage of the semen is not a contributing factor at all, so no worries. To the second question, is it normal or abnormal to have semen leakage? And the answer is very simple. It is normal, because the best, normal and healthier sperms have already made their way through your cervix into the uterus to the fallopian tube to fertilize an egg, and the weak ones are coming out with the fluid. So it is normal for sperms to leak out of your vagina after sexual intercourse. It is a natural phenomenon. But hey, there are rare situations which we might say it is abnormal, and we're going to look at that pretty soon. Now, some women have complained that they saw this leakage even hours or a day after sexual intercourse. Then again, it is normal to experience semen leakage even an hour, a day, or days after sexual intercourse. It does not affect your chances of getting pregnant. Alright, if you are new to my channel and you are interested in topics like fertility and overall wellness, then you are at the right place. So make sure you subscribe to my channel and hit that notification bell to stay updated with our videos. Thank you and God bless you. We move on to the third question, the factors that affect sperm leakage after sexual intercourse. We said mostly it is normal, but the amount of semen released in that ejaculate will determine how much of the leakage we see. If the volume of the semen is large, then the amount of leakage you will experience after sexual intercourse will be larger compared to if the volume of the semen was smaller. For example, if you have sexual intercourse today with your partner and he ejaculates a large amount of the semen, then you should expect a large amount of the fluid to leak out of your vagina. And if that same day or the next day you have sexual intercourse, definitely the volume of the ejaculate might reduce. In that case, the amount of leakage you will see will be relatively smaller compared to the amount of volume you saw the day before or the days before. So in rare situations or abnormal situations, we may experience excessive sperm leakage after sexual intercourse, and there may be some underlying causes that needs to be addressed. Some of the possible causes include, number one, cervical incompetence, and that is a condition in which the cervix is unable to stay closed during pregnancy, which can lead to premature delivery or miscarriage. However, This typically is a concern for women who are pregnant or trying actively to get pregnant, since the cervix is unable to close up, so you get excessive leakage of the semen. The second abnormal situation will be an infection or inflammation. You see, an infection or inflammation of the female reproductive tract can cause irritation and discharge, which can block some amount of the semen trying to get into the uterus, and that can also lead to excessive leakage and infertility. And lastly, when you have uterine prolapse, this is a condition in which the uterus and a portion of the upper vagina falls down into the vaginal canal, and in severe cases through the opening of the vagina, potentially leading to sexual discomfort or urinary problems. This would also cause excessive leakage. If you are experiencing this excessive leakage and you are worried about it, then talk to your doctor or gynecologist. They may help you identify the underlying cause. They can perform some physical examination and order some tests to help you identify that specific underlying cause. And treatment may depend on that underlying cause. It could be medication or some surgical procedure for these special cases. But under normal circumstances, sperm leakage after sexual intercourse is something normal and natural. Lastly, let's debunk some myths surrounding sexual intercourse and infertility. You see, one of the things I used to tell these women who were worried about this sperm leakage after sex because they were actively trying to get pregnant was to lie down for a while and raise their legs up a bit after sex to reduce that leakage. But truth be told, you don't need to lie down for 30 minutes or hours because you want all the sperm cells to go inside. It is not necessary at all. The reason I did tell them to do that was to work on their psychology. It doesn't play any important physical role because the healthier sperms have already made their way to where they are needed within seconds or minutes after ejaculation. So after the act, feel free to go about your daily activity. You don't have to worry about the leakage. That extra lying down, raising your legs and your hips are not necessary at all. The last myth is peeing immediately after sexual intercourse kills sperm cells and prevents pregnancy. And this myth is not true at all. Urinating after sex is not going to flush out the sperms from your vagina. And it is okay to pee immediately after sex. And in fact, it is advisable and healthier that you pee right after a sexual intercourse with your partner to help prevent UTI, that is urinary tract infection. The entries and the outlets are separate. The hole for the sperm is different from the hole for urination. It doesn't affect the sperm at all because the canals are not the same. So it is completely natural and healthy that after sexual intercourse, you go ahead and pee immediately to prevent a UTI. So I hope I have been able to answer all your questions, alleviate your worries, that you don't have to worry about sperm leakage after sexual intercourse. It doesn't affect your chances of getting pregnant. But like I said, in rare situations, if you see an excessive leakage, then see your gynecologist. But under normal circumstances, it is natural and normal to experience semen leakage after the act of sex from your vagina. Alright, so if you found this video informative and you want more videos like this, then give us a like, share and comment below, and I will be glad to respond to you. Always remember that God wants you healthy, your health, your life, and I will see you in the next video right up here. God bless you and thanks for watching.